So this is the anterior view. Okay, let me give you a couple of landmarks so you kind of can orient yourselves. This whole thing is the pelvic girdle here. This is that iliac crest. This is the ilium. This would be the pubic bone here. And this is where I would have the pubic symphysis, which is going to attach one hip bone to the other hip bone anteriorly. Okay. So I'd like to start with the quadriceps muscles. So the quadriceps, as you might guess, the quadriceps group is made up of 4 different muscles. 3 of them you will be tested on. This muscle that would be right straight in front of your femoral region, this is the rectus femoris. The rectus femoris. And then I have the Vastus Medialis, another quadriceps muscle. Vastus meaning big, medialis because it's sitting on the medial side. Okay. Vastus Medialis. Similarly, if I go to the lateral direction from the rectus femoris, then I get to this muscle here, which is the Vastus Lateralis, okay, the big muscle on the lateral side, Vastus Lateralis. Now the Vastus Lateralis is actually really big. And when we're looking at this laterally, it's actually going to include all of this. It's going to go underneath this big tendon and then all of this as well. And so Vastus Lateralis would be all of this. Okay. Since I'm here, let me go ahead and mention my favorite muscle name. Right here is the tensor fascia latae. Tensor fascia latae. It's got latae in the name, so what's not to love about that part? But you see all of this huge tendon, this is all part of the muscle. That's why it has fascia in the name. Okay, so tensor fascia latae. All right, tensor fascia latae. Right. And then we see that the vastus lateralis going underneath that muscle. This is the gluteus maximus. Okay, so gluteus maximus. Okay. And here I start to see the hamstring muscles. So we have 3 hamstring muscles. Okay, now we have a better view. I can actually see all 3 in this view. So this is the biceps femoris that sits laterally. Okay. I have 2 that sit medially. I have one on top, which is here at 27, and the other one is sitting underneath this, and it's here as well as here. Okay, so it's hiding underneath that other one. This one at 27, this is the semitendinosus. The semitendinosus. Semitendinosus. Underneath this is the semimembranosus. Semimembranosus. So what I like to say is I say, remember that the semitendinosus sits over the semimembranosus. Okay, so this is now the medial view, So I mentioned that this is the semitendinosus. The semimembranosus lies underneath the semitendinosus. The muscle that lies as medial as you can get on your thighs is going to be this muscle here called the gracilis. The gracilis. When I hear gracilis, I like to think of a gracious dancer. This muscle here, just this little triangle, this is the adductor longus. The adductor longus. Okay, adductor longus. You might say, well, it doesn't look very long. It does, it just continues deeper. Next, I have this strap-like muscle here. This is called the sartorius. The sartorius. The sartorius muscle. The sartorius muscle, the name actually comes from the word strap-like, the strap-like muscle. I like to give this the nickname of the hacky sack muscle. This is the muscle that's going to allow you to cross your legs, to play hacky sack, to kick a soccer ball straight up in the air, things like that. Okay. sartorius. This is the vastus medialis here again, one of your quadriceps. Rectus femoris again. This is the tibia. This muscle here is going to be the tibialis anterior. Tibialis anterior. Here I can still see a little bit of the tibialis anterior, which is here. You might remember when I was talking about the fibula, I was saying that the bump that you guys feel on your ankle, that's actually the fibula. So this is going to be that fibularis longus, also known as the peroneus. Fibularis longus at 32 here. And this is the soleus, These are the gastrocnemius muscles. Gastrocnemius. So these are called the gastrocnemius muscles. On the other side, I can see more of that soleus.